Hi, welcome to another episode of Talking with Docs. I'm Dr. Paul Zalzal.
And I'm Dr. Brad Wiening.
And I'm Andrea, the physiotherapist.
Thanks for joining us again today, Andrea.
On today's episode, we're going to talk about how to negotiate the stairs after a hip or knee replacement, which certainly is a cause of a lot of trepidation for patients.
Oh, people ask that all the time. Am I going to be able to use stairs, or am I going to have to live on the main floor?
Or do we need an acorn stair lift?
Or do I need a stair lift, or do I need to stay in the hospital for a month until I can use stairs?
Yes.
So, Andrea, you're going to tell us how to use stairs.
Yes.
After. Are you also going to teach us how to use the escalator after a hip and knee replacement?
Sure.
Elevator? Do you teach them how to use the elevator? For those that fail the stairs?
You have to take the elevator to get to the main level to leave the hospital, so you'll get some practice before you leave.
Okay.
One thing I would ask is, and patients ask me all the time, when am I going to be able to do stairs? Is it like a week? Is it 2 weeks?
We often do stairs with patients post-op day 1.
Excellent.
So anywhere from day 1 to 2, it's actually your good leg that does most of the work. So stairs are usually not a problem.
And at our hospital is one of the criteria for discharge, is it not?
Yes.
Okay. Awesome.
And our surgical ward is the 7th floor, and we make you take the stairs to leave. That's not true. We don't do that. Okay, let's move on.
All right, so for stairs, it's always preferred that you have at least one railing. If you don't have a railing and you know you're going to have surgery, it's suggested that you try to get one installed because it's a lot easier to do stairs holding onto a railing with the cane versus no railing at all. So no matter what side the railing is on, you would always go to that side. I know I said in the previous video you hold your cane in the side opposite of your operated leg, but for stairs, it's a different story. You always want to hold onto the railing. So if I was at home and my railing was on my right side, I'd walk up to the stairs. I would step up with my good leg. So you push through the cane, lean on the railing, and step up with your good leg. Push up, and then bring the cane up to the same step. Again, good leg goes up first, and then the bad leg and the cane come together. Just think of the cane always staying with the bad leg because the bad leg needs help. So the cane is the assistant. So up again with your good leg. So coming down, it would be the opposite. So again, if my right leg is my operated side, you bring the cane down first so you can lean on it, and then bring your sore leg down. Cane, and then sore leg. And then you would just continue on until you reach the bottom of the stairs. Okay, a lot of people ask, when am I going to be ready to go up the stairs the normal way, like 1 foot after the other? Again, that varies between people, and your physiotherapist will guide you to when you're ready for that.
Well, there you have it. That was a great demonstration of going up and down the stairs, Andrea. Really appreciate that. That's going to be an important resource for patients after their hip or knee replacement.
Yes, Andrea, thank you so much for your time to show us that stuff. It did, however, hurt my feelings when you called the operated leg the bad leg, because we spend a lot of time trying to make that the good leg, but I get what you're trying to say.
I should have used your surgical leg.
I get what you're trying to say.
Anyway, message received. And if you like this video, please like it and subscribe to our channel.
And remember, you are in charge of your own health and your own gait.
See you next time.